Hi, I'm Dr. Mickey Barber with Better Life Carolinas, and we're going to talk about erectile dysfunction and function of the penis. So, like any other therapy out there, it's not one time. So, if you're having some issues with erectile dysfunction and you're interested in GAINSWave or shockwave therapy to restore that tissue to your penis, first of all, if you think one therapy is going to do it, that's absolutely not true. Think about if you have a tendon that's torn, or you need to go to physical therapy for something. You can't walk in there and have one therapy and everything's back to the way it was. It's not the way it is. And I want to talk to you too about not waiting too long. So this is preventative therapy, really to restore the tissue, the blood supply, the nerve conduction to the penis. So don't wait too long. Yes, can we help you? Sure. But if you're starting to notice any change whatsoever, it's better to get those therapies first. The shockwave therapy works by being applied to the penis. It goes in the shockwave and kind of disrupts that tissue. And the body's response is to say, hey, there's something going on here that's a little bit different. And so the body responds by calling in, recruiting these growth factors. And they're pretty impressive. There's the collagen growth factor, there's the vascular growth factor, there's the neuro growth factor. So all those factors work together over time to recreate nerves, to recreate blood vessels, angiogenesis, and to store up that collagen. So now the penis becomes more like what it was when you were 25. Because guess what? Everything changes. Our face starts to change, the collagen changes, our blood supply, you can see it in your skin as your skin starts to thin on your hands and the blood supply becomes different. That's exactly what happens in the penis. One thing that's really upsetting to us is when guys wait too long. So for example, you notice that you're having some trouble sustaining an erection. So what happens? That starts to play with your head. So now you, rather than have sex, you put it off. So now you've gone a month, now you've gone 2 months, then you go 6 months, then you go a year. Well, as you're doing that, that tissue is starting to die, literally starting to die. So it needs to be used. It's like any other muscle in your body. If you're not using it, it's going to atrophy and it's not going to be as active and as vital as it once was. So we recommend as soon as you have an issue with maybe losing an erection or not being able to maintain an erection for penetration, or maybe not being able to have a second erection when you used to be able to, that's the time to pick up the phone. And that's the time to get started on the GAINSWave therapies and other things that we do that can help you to get that tissue back to what it was when you were more youthful. That's what happens to everybody. It happens to women, it happens to men, it happens on the inside, and it happens on the outside. And we get asked a lot, well, is one treatment going to do it? And the answer is no. I wish I had that for everything that we do. If we could just do one pill, one shot, one therapy, wouldn't that be great? But that's not the way it is. The body's not that simple, and the repair process is not overnight. Once we get those kind of therapies on board, you'll be the first to know. But right now, we know that it's a process, and it's really a restorative, regenerative process over time. Does it take some patience on your part? Sure. Might you start to notice some changes after the 6th, 7th therapy? Absolutely. And it depends on your physical condition. It depends on what kind of medications you're on. Depends if you have some other diseases like hypertension or diabetes, history of prostate cancer. It depends on how long you've not been using that penis. So it's important. Again, like I said, ejaculation is important. We know it helps to protect your heart. We know that men who ejaculate more frequently have a lower risk of prostate cancer. So all these things work together. It's not like it's not attached. So it's important to exercise that part of your body just like you exercise every other part of the body. The bottom line is we know we can help you. We've had this GAINSWave therapy for almost 2 years. We've been really, really excited by the responses and the amount of help we've been able to give men and their partners. So we ask you to please call us right away or go to our website, betterlifecarolinas.com, and please come in and see us and let us help you get back to what you were before.